The gallbladder channel of the foot Shaoyang. If Taiyang refers to the sun and Shaoyin refers to water, then Shaoyang is like the mountain in between the two. The hand and foot Shaoyang you can think of as the water cycle within the forest, within the mountain, and within the climates throughout that mountain. I saw cliff faces in China with various forms of vegetation coming out, and throughout the day, the mountain would seem to sweat. And there is sweat at the top of this mountain that would make it difficult to climb. And this sweat is sometimes referred to as tears, because it looks like tears running down, especially for holy mountains. There are points on the Shaoyang meridian, the gallbladder meridian of foot Shaoyang, that refer to the head governor of tears and the foot governor of tears. I believe these refer to this same type of water cycle that's seen in rural areas in China. When we look at the gallbladder channel, especially toward the head, it seems to zigzag quite a bit. Instead, what I would do is challenge you to think of this as spirals. Think of this as the mist and clouds that go into one another at the top of a mountain. The mist that becomes the breath of the forest, that becomes the clouds, an inseparable connection that is swirling and spiraling, at the same time running downward and being drawn up as the heat will draw the vapor up through those rocks, up through the mountain, up through the vegetation. When you think of the gallbladder channel foot Shaoyang in this way, it becomes a lot easier to understand. In the Lingshu Jingmai, it states, the gallbladder channel of foot Shaoyang originates in the outer canthus, ascends to the corner of the forehead, curves behind the ear, runs alongside the neck, in front of the Sanjiao channel of Han Shaoyang, to the shoulder. It then passes the Sanjiao channel and continues down the supraclavicular fossa. One branch emerges behind the ear and enters the ear. It emerges and passes in front of the ear to the outer canthus. Another branch, coming from the outer canthus, turns downward to stomach 5 and meets the Sanjiao channel in the infraorbital region, then passes through stomach 6. It goes down to the neck and enters the supraclavicular fossa, where it meets up with the main channel. From there, it goes down further into the chest and passes through the diaphragm to connect with the liver before connecting to the gallbladder. It runs inside the hypochondriac region and emerges from the lateral side of the lower abdomen near the femoral artery at the inguinal region. From there it runs superficially along the margin of the pubic hair and travels transversely into the hip. A straight branch runs downward from the supraclavicular fossa, passes in front of the axilla alongside the lateral aspect of the chest and through the free end of the floating ribs to the hip region. Then it meets with the previous branch and descends along the lateral aspect of the thigh to the lateral side of the knee, going further downward along the anterior aspect of the fibula, all the way to its lower end. It reaches the external malleolus. It goes along the dorsum of the foot to the lateral tip of the fourth toe. A branch arises on the dorsum of the foot, runs between the first and second metatarsal bones to terminate at the portion of the big toe. So it goes through the liver, gallbladder, and diaphragm, and through the eye and ear. This is a long channel Much like the stomach channel, as a result, it has a lot of indications. The miraculous pivot, 灵数经脉, states, the diseases that stem from the gallbladder channel of foot Shaoyang are bitter taste in the mouth, frequent sighing, pain in the chest, and hypochondria with inability to move around, dull complexion, lack of muscle tone, lusterless skin, heat on the lateral side of the feet. These are due to adverse flow of qi in the Shaoyang channel of the foot. The diseases of foot Shaoyang are related to bone, manifest as headache, chin pain, pain in the outer canthus, pain and swelling of the supraclavicular fossa, axillary swelling, scrofula, chills, malaria, pain in the chest, hypochondrium, rib, thigh, knee, lower end of the fibula, and the external malleolus, with inability to move the fourth toe. Gallbladder channel, Shaoyang in general, has a moderating effect on the entire body. As such, it's a very important channel. Gallbladder 1. 同治疗 Gallbladder 1. 同治疗 on the face, lateral to the outer canthus of the eye, on the lateral edge of the orbit. Eye diseases, red eyes, tearing from exposure to wind. Needle transversely, 0.3 to 0.5 cun. Gallbladder 2, 听会, on the face, anterior to the intertragic notch, in the depression formed by opening the mouth, posterior to the condyloid process of the mandible. Deafness, tinnitus, toothache, clenched jaw, deviation of the mouth and eye, 0.5 to 8 cun. Gallbladder 3, 上关, anterior to the ear, directly above stomach 7, in the depression above the upper border of the zygomatic arch. Headache, deafness, tinnitus. Really great in my experience for trigeminal neuralgia, jaw pain of all types. Needle perpendicularly, 0.5 to 8 cun. Points of the head. Gallbladder 4, 汗液. On the head, in the hair, above the temple, at the junction of the upper fourth and lower 3/4 of the curved line connecting stomach 8 and gallbladder 7. Head pain. Pain in the outer eye, toothache, convulsions, epilepsy. Convulsions and epilepsy would be for phlegm in the gallbladder channel and fire rising upward. So this is an exit point to, well, it's not an exit point, but it's a point to alleviate that and allow the heat to escape. Needle transversely, backward, 0.3 to 0.4 cun. Gallbladder 5, 旋捋, on the head, in the hair above the temple, at the midpoint of the curved line connecting stomach 8 and gallbladder 7. Head diseases, eyes, mouth, nose, migraine, facial swelling, pain in the outer canthus, and profuse nasal discharge, as well as nosebleed, tooth pain. Needle transversely, 0.5 to 0.8 cun, toward the back of the head. Gallbladder 6, 旋理, on the head, in the hair above the temple, at the junction of the upper 3 and lower 1/4 of a curved line connecting stomach 8 and gallbladder 7. Migraine, pain in the outer canthus, tinnitus, same as all the others. However, one is different in gallbladder 6, which is frequent sneezing. transversely 0.5 to 0.8 cun. Gallbladder 7, 去宾, on the head, at the crossing point of the vertical posterior border of the preauricular hairline and horizontal line through the ear apex. Swollen cheek, headache, swelling under the chin, clenched jaw, pain in the temporal region, infantile convulsions. Needle transversely backwards 0.5 to 8 cun. Gallbladder 8, 帅骨, on the head, directly above the apex of the ear 1.5 cun, above the hairline, directly above Sanjiao 20. Dizziness, vomiting, migraine, and convulsions, infantile convulsions. This is also used for hangovers. Maybe it's the whole headache, dizziness, and vomiting thing. I used it in TCM school and experimented with a roommate. I'm not sure if it worked or if it was just, time. But it seemed to alleviate some of the heat that's associated with post-drinking in a similar way to Gegenhua, kind of releasing that gallbladder channel along the sides. .5 to 1 cun transverse. Gallbladder 9, 天冲, on the head, directly above the posterior hairline of the root of the ear, 2 cun above the hairline, and 0.5 cun posterior to gallbladder 8. Headache, epilepsy, swelling, and pain in the gums. Needle transversely 0.5 to 1 cun. Gallbladder 10, 腹白, on the head, posterior and superior to the mastoid process at the junction of the middle third and upper third of the curved line connecting gallbladder 9 and gallbladder 12. Headache, tinnitus, and deafness. Needle transversely 0.5 to 8 cun. Gallbladder 11, 头翘阴, on the head, posterior and superior to the mastoid process at the junction of the middle 1/3 and lower 1/3 of a curved line connecting gallbladder 9 and 12. One of the indications of this is bitter taste in the mouth and bleeding from the root of the tongue. Dear Lord. 5 sense organ disease, tinnitus, deafness, sore throat, lots of heat coming to the upper jowl, stiffness and pain in the neck, as well as hypochondriac pain because of the gallbladder's direction in that area, that it traverses that area, and goiter. Needle transversely 0.5 to 8 cun. Wanggu, gallbladder 12, on the head in the depression posterior and inferior to the mastoid process. Headache, insomnia, swollen cheek. Retroauricular pain, deviation of the mouth and eye, toothache, 0.5 to 8 cun. Gallbladder 13, 本身, root of the spirit on the head, 0.5 cun within the anterior hairline, 3 cun lateral to do 24 at the junction of the lateral third and medial 2/3 of the distance between do 24 and stomach 8. For mental diseases, as well as wind and phlegm, fire, essentially. We're looking at epilepsy, infantile convulsions, head and nape diseases, headache, dizziness, stiffness of the neck. Needle transversely, 0.5 to 8 cun. Gallbladder 14, Yangbai. On the forehead, directly above the pupil, 1 cun above the eyebrow. Frontal headache, pain in the supraorbital ridge, all things eyes, especially with wind in the eyes causing tearing. Needle transversely 0.3 to 0.5 cun. Gallbladder 15, 头鳞起, on the head, directly above the pupil, and 0.5 cun above the anterior hairline at the midpoint of the line connecting do 24 and stomach 8. Mental diseases, epilepsy, wind stroke with coma. Needle transversely 0.3 to 8 cun. Gallbladder 16, 目疮, on the head 1.5 cun above the anterior hairline and 2.25 cun lateral to the midline of the hairline of the head. Lateral to the midline of the head, not the head, that's outer space somewhere. So on the head, 1.5 cun above the anterior hairline, 2.25 cun lateral to the midline. Head, face, and 5 sense organs, swelling and pain in the eyes, glaucoma, nasal obstruction, and stiff lip. So gallbladder 16, stiff upper lip. So treat your classically British people with this point. Needle transversely 0.3 to 0.5 cun. Gallbladder 17, Jueyin, on the head 2.5 cun above the anterior hairline and 2.25 cun lateral to the midline of the head. Gallbladder 17 has 2.25 in two different directions. It's kind of squared off. That's interesting. Gallbladder 17, 2.25. Remember that. Migraine dizziness. Needle transversely 0.3 to 0.5 cun. Gallbladder 18, Changling, on the head 4 cun above the anterior hairline and 2.25 cun lateral to the midline of the head. Headache, dizziness, nosebleed, and nasosinusitis. Needle transversely 0.3 to 0.5 cun. Gallbladder 19, Nao Kong. So this is brain cave, or brain empty area, on the head and on the lateral side of the upper border of the external occipital protuberance, or DO 17, 2.25 lateral to the midline of the head. Headache, stiffness of the nape, dizziness, tinnitus, pain in the eyes, epilepsy. Needle transversely 0.3 to 0.5 cun. Gallbladder 20, Feng Shi, one of my all-time favorite points. I love this point with all my heart. I've used it a lot in clinic. It's so beautiful. On the nape, below the occipital bone, on the level of DO 16 in the depression between the upper ends of the sternocleidomastoid and trapezius. So because of this crossing point of sternocleidomastoid and trapezius, you can get basically all things neck and even through the back. It's also incredibly good for wind, febrile diseases, sweating, stiff pain in the neck, head, face, all things wind. Mental disorders as well when they start to involve liver wind or, basically liver wind due to phlegm or fire, blood deficiency. All things that can involve liver wind. When it manifests in this way, it helps to eliminate. Needle obliquely, 0.5 to 8 cun, toward the opposite eye. 0.5 to 0.8 cun toward the opposite eye. Some people say tip of the nose, whatever. Just make sure you're not going in any deadly directions. Points of the shoulder and lateral side of the chest. Those are our gallbladder 21 to 23. Gallbladder 21. Jianqing, shoulder well. Another beautiful point. On the shoulder at the midpoint of the line connecting DO 14 and the lateral end of the clavicle. Shoulder stuff. It'll open up the trap. Gynecological diseases because it pushes down. That's a very strong descending action. That's the direction of the gallbladder channel. Scrofula and consumptive diseases. Needle perpendicular, 0.5 to 8 cun. The apex of the lung is around here, so avoid deep needling. Gallbladder 22, Yuan, on the mid-axillary line, 3 cun below the axilla, in the fourth intercostal space. So 3 cun down, fourth intercostal space. On that midline, below the axilla, you have gallbladder 22, Jueyin. Good for opening the chest, axillary swelling, hypochondriac pain, arm pain, inability to raise the arm. Needle obliquely, 0.5 to 0.8 cun. Gallbladder 23, Jueyin, on the lateral side of the chest, 1 cun anterior to gallbladder 22, level with the nipple in the fourth intercostal space. Chest stuff, asthma. Needle obliquely, 0.5 to 8 cun. Now to the abdomen, 24 through 28. Gallbladder 24, 日月, the front mu point of the gallbladder. On the chest in the seventh intercostal space, 4 cun lateral to the anterior midline. All things gallbladder, hiccup, regurgitation of food, acid regurgitation, bitter taste in the mouth, excessive salivation, jaundice, just all things gallbladder. Diseases of the hypochondriac region, hypochondriac pain. 0.5 to 0.8 cun. Gallbladder 25, Jingmen, the front mu point of the kidney on the lateral side of the abdomen, 1.8 cun posterior to liver 13, below the free end of the 12th rib. Again, gallbladder stuff, abdominal distension, pain in the lumbar in this case, coldness on the nape and back, pain in the medial side of the scapula. That's kind of interesting. And that's because it's the front mu point of the kidney. So this is the way that the gallbladder channel, the way that wood is influencing or having a relationship with water. And in this case, the water is both the kidney and, as you can see, the taiyang as well, going through the nape of the neck and the back. Also for kidney diseases, yellow urine, pain in the lower abdomen, and diarrhea. So gallbladder 25 is the front mu point, and it's because basically it's opposite to the kidneys. Needle obliquely, 0.5 to 8 cun. Gallbladder 26, Daimai, on the lateral side of the abdomen, 1.8 cun below liver 13, at the crossing point of the vertical line through a point inferior to the free end of the 11th rib, and a horizontal line through the umbilicus. Gynecological diseases, lower abdominal pain, lumbar pain, prolapse, all things that daimai do. Needle perpendicularly, 0.5 to 0.8 cun. Gallbladder 27, 5 in the lateral side of the abdomen, anterior to the anterior superior iliac spine, 3 cun below the level of the umbilicus. Morbid leukorrhea, pain in the lumbar and hip, pain in the lower abdomen, hernia, constipation. Needle perpendicularly, 0.5 to 1.5 cun. Gallbladder 28, 胃道, on the lateral side of the abdomen, anterior and inferior to the anterior superior iliac spine, 0.5 cun anterior and inferior to gallbladder 27. So gallbladder 27, you're going to go 0.5 cun in front and down, anterior and inferior to gallbladder 27. For morbid leukorrhea, morbid. Prolapse of the uterus, also not good. Pain in the lower abdomen and hernia. So just, all bad days, right? Needle 0.5 or 0.8 to 1.5 cun. Got to go a little deeper there, a little more cushion. 0.8 to 1.5 cun. Obliquely in an anterior and inferior direction. Anterior and inferior direction. Now onto the hips and thigh. Gallbladder 29 through 33. Gallbladder 29, 猪疗, On the hip, at the midpoint of the line connecting the anterior superior iliac spine and the prominence of the great trochanter. Muscular atrophy, weakness, pain, motor impairment, paralysis of the lumbar and legs, perpendicular or obliquely 1.5 to 2 cun. Gallbladder 30, Huan Tiao, on the lateral side of the thigh at the junction of the midline of the lateral third of the line connecting the prominence of the greater trochanter and the sacral hiatus while lying on the lateral recumbent position with the knees raised. This is an amazing point. I really love this point. It can be just amazing for sciatica because the piriformis is not far off at all. Lumbar and leg diseases, pain in the lumbar and hip, weakness, pain, and motor impairment. Really good for sciatica. Most sciatica is really piriformis syndrome anyway. So, beautiful point for sciatica. Needle perpendicularly 2 to 2.5 cun. Gallbladder 31, Feng Shi. So this is the point, classically they say you have your hands at your sides and where the middle finger touches at the center of the IT band. However, some people have longer arms. So, God, I could describe racial differences. I'll definitely get in trouble for that. Moving on the lateral side, lateral midline of the thigh, 7 cun above the popliteal crease, on the place where the middle finger tip touches the thigh, when standing erectly with the arms hanging down freely. Again, some of us have longer arms. Sorry. Yes, I have longer arms. Like an ape. I'm not saying it hurts my feelings, but people do point it out sometimes, and I do feel a bit like a missing. Anyway, aching pain of the lumbar and legs, muscular atrophy, weakness, pain and motor impairment of the lower limbs, beriberi, and itching. Itching due to wind in the gallbladder channel. If we're going to be specific, perpendicular insertion 1 to 1.5 cun. Gallbladder 32, Zhongdu, on the lateral side of the thigh, 2 cun above gallbladder 31, or 5 cun above the popliteal crease, as you wish, between the femoral lateral muscle and the biceps femoris. For aching pain, numbness, muscular atrophy, weakness, and motor impairment of the leg and knee, as well as hemiplegia. Needle perpendicularly 1 to 1.5 cun. Gallbladder 33, Shaoyang 1, on the lateral side of the knee, 3 cun above gallbladder 34, in the depression above the external epicondyle of the femur. Swelling and pain of the knee, hypertonicity of the sinews and popliteal fossa, numbness of the leg. Perpendicular insertion 0.8 to 1 cun. Lower leg points. Gallbladder 34. I love this point as well. Yangling-quan, the Hesi point and influential point of the sinew. On the lateral side of the leg in the depression anterior and inferior to the head of the fibula. Whew, boy howdy. All things liver and gallbladder, all things to do with fascia in the body. Liver excess that you can drain off through the gallbladder. Seminal emission, urinary incontinence, hypertension. Again, this is all liver is pushing, gallbladder is not descending kind of stuff. Yeah, just great point to push things down. Bring it past that knee gate. Sometimes Qi has trouble getting past the knee. This just gives it a little tug down. Needle perpendicularly or obliquely downwards 1 to 1.5 cun. Gallbladder 35, Yangjiao, the Shi cleft point of the Yang Wei. On the lateral side of the leg, 7 cun above the tip of the external medial or lateral malleolus, on the posterior border of the fibula. It's good for cray-cray, as well as diseases along the channel, swollen face, sore throat, muscular atrophy. Needle perpendicularly, 0.5 to 8 sun. Gallbladder 36, Huaiqiu, the Shi cleft point. On the lateral side of the leg, 7 sun above the tip of the external malleolus, or lateral malleolus, as you please, on the anterior border of the fibula, and on the level of gallbladder 35. So we're just popping over a little bit there. All things to do with the channel, because it's the Shi cleft point on a yang channel. So if it was a yin channel, it would stop bleeding somewhere. But in this case, it's just going to abruptly stop pain. Needle perpendicularly, 0.5 to 8 sun. Gallbladder 37, Guangming, the luo connecting point, which means we've got some liver buddy system going on. On the lateral side of the leg, 5 sun above the tip of the external malleolus, on the anterior border of the fibula. Eye diseases due to liver fire, disease along the channel, weakness, pain, motor impairment of the lower limbs, coldness in the hands and feet. So yeah, it's all the gallbladder stuff and then some liver stuff thrown in because it's the lower point. Perpendicular insertion, 0.5 to 8 sun. Gallbladder 38, Yangfu, the Jing River point. So this is the lateral side of the leg, 4 sun above the tip of the external malleolus, lateral malleolus if you please, slightly anterior to the border of the fibula. Head and face diseases, outer canthus, channel stuff. Yeah, it's just channel stuff and scrofula. Needle perpendicularly, 0.5 to 8 sun. Gallbladder 39, Xuanzong, the influential point of the marrow. On the lateral side of the leg, 3 sun above the tip of the lateral malleolus on the anterior border of the fibula. Some people say posterior, some people say anterior. I'm kind of in camp posterior, but I think anterior may be what the test says. Sinew and bone disease, stiffness of the neck, aching pain in the joints, hemiplegia, axillary pain, also dizziness and insomnia. And of course, all things marrow. Needle perpendicularly, 0.5 to 8 sun. Foot stuff. Gallbladder 40. Qiu, the yuan source point, anterior and inferior to the external malleolus in the depression lateral to the tendon of the long extensor muscle of the toes. Head, nape diseases, migraine, liver and gallbladder, disease along the channel pathway, herpes zoster, scrofula, etc. Perpendicular insertion, 0.5 to 8 sun. Gallbladder 41, Zulinqi, the shoestring point and confluent point of the daimai. On the lateral side of the dorsum of the foot, posterior to the 4th metatarsophalangeal joint in the depression lateral to the tendon of the extensor muscle of the little toe. This is also an exit point, and this is very important. So why is it the confluent of the daimai? Well, when you practice Qigong, one of the things that you do in the beginning is drain off the yang channels and you sink the gallbladder channel down. And once it starts to sink all the way down, you start to feel qi coming up through the yin channels, right? Through the liver channel in particular, once you sink that. And at the same time, you'll start to feel warmth in your Mingmen, in the lower back, and you'll start to feel the daimai open up. So there's a relationship between sinking the gallbladder, which allows the daimai to open up, and it allows the Mingmen to spark, because if the gallbladder is in too much excess, you really can't get that sensation. Just speaking personal experience with Qigong here. So this is how I've come to understand, all right, why is Zuling Qi why is gallbladder 41 the confluent point of the girdling vessel? Because it's also the exit point. So as it exits out there, then the Mingmen can start to engage and the daimai can start to open. This is indicated for head and face stuff because it drains down the channel. Chest and hypochondriac because that's where the channel go. Disease along the channel pathway. And indirectly for thigh stuffs. The name uses the word tears. From a Western understanding, it might be very easy to say, oh, well, it's good if people are crying. The tears in this case really have more to do with the water cycle as you see it in mountains. Not to say that tears aren't involved in that, but really it's looking at fluid physiology within the body, of which tears are a part. But if you fixate on tears alone, you may miss the bigger picture. Gallbladder 42, 第五会, on the lateral side of the dorsum of the foot, posterior to the 4th metatarsal phalangeal joint, between the 4th and 5th metatarsal bones, medial to the tendon of the extensor muscle of the little toe. Pain in the canthus, tinnitus, distending pain in the breast, swelling and pain in the dorsum of the foot. Oblique or perpendicular insertion, 0.5 to 8 cun. Gallbladder 43, 下溪, the yin spring point, on the lateral side of the dorsum of the foot, between the 4th and 5th toes at the junction of the red and white skin, proximal to the margin of the web. Yeah, just what does the channel do? Everything that we've mentioned before is what this point allegedly does. Pain of the breast, asthma, cough, all things head, face, head, chest stuff, and disease along the channel pathway. Oblique or perpendicular insertion, 0.3 to 0.5 cun. Gallbladder 44, 足鞘阴, the Jingwell point, on the lateral side of the 4th toe, 0.1 cun posterior to the corner of the toenail. Head, face, and 5 organs. Sense diseases, swelling and pain in the eyes, deafness, tinnitus, chest stuff, dream-disturbed sleep, febrile diseases. It's a yin point, or it's a Jingwell point. Needle perpendicularly, 0.1 to 0.2 cun. And now for the most used channel in TCM, the liver channel. According to the miraculous pivot, 灵数经脉, the liver channel of foot Jueyin originates at the lateral side of the great toe, runs along the dorsum of the foot, passes through a 0.1 cun anterior to the medial malleolus, and ascends to an area 8 cun above the medial malleolus. From there it runs across and behind the spleen channel of foot Taiyin and up to the medial aspect of the knee, and along the medial aspect of the thigh to the pubic region. There it curves around the external genitalia, giving them a high five, and continues up to the lower abdomen, runs upward and curves around the stomach, enters the liver, its pertaining organ, and connects to the gallbladder. From there it continues to ascend, passing through the diaphragm and branching out to the costal and hypochondriac region. Then it goes up along the posterior aspect of the throat to the nasopharynx and connects with the eye. Running further upward, it emerges from the forehead and meets the dew vessel at the vertex. Which is why a liver channel, you get vertex headaches. The branch, which arises from the eye system, runs downward into the cheek and curves around the inner surface of the lips. A branch coming from the liver passes through the diaphragm and runs into the lung. The liver channel connects to the liver, gallbladder, stomach, lung, and diaphragm. It passes the external genitalia, throat, nasopharynx, eye, cheek, and inner surface of the lip. Ling Shu Qing Mai manifestations. The diseases that stem from the liver channel of foot Jueyin are lumbago with inability to bend forward and backward, swelling of the scrotum, and swelling of the lower abdomen in women, or even dry throat and dull complexion. The diseases of the liver channel of foot Jueyin relate to the liver and manifest as fullness of the chest, vomiting, indirect inguinal hernia, enuresis, and retention of urine. Liver 1. 大敦, the Jingwell point. On the lateral side of the great toe, 0.1 cun posterior to the corner of the toenail. Uterine bleeding, gynecological diseases, prolapse of the uterus. Liver and kidney diseases, hernia, enuresis. The job of the liver channel is to ascend, the job of liver chi is to ascend. So this is why, even though this point is on the foot, it can be used for prolapse of the uterus, because it's going to spark the channel to go upward. Needle obliquely 0.1 to 0.2 cun, or prick to bleed. Moxa if you want. Liver 2, Xingjian, the Ying spring point. On the dorsum of the foot, between the first and second toes, at the junction of the red and white skin, proximal to the margin of the web. Head, face, five sense organ diseases. Basically moving liver fire. Liver fire as it relates to the chest, heart, hypochondrium. Liver fire as it relates to asthma and coughing. Blood diseases, again, due to heat or fire in the liver channel. This is the Ying spring and fire point. So, yeah, this is same way with gynecological diseases. It's a Ying point. Needle perpendicularly 0.5 to 8 cun. Liver 3, Taichung, you know it, you love it, you probably used it today. The Yuan source point, shoestring point of the liver channel. Dorsum of the foot in the significant depression between the first and second metatarsal bones. All things liver channel and give it a boost. Yep, including mental diseases and lumbar pain. Scrofula. 0.5 to 0.8 cun. Liver 4, Zhongfeng, the Jing River point. On the dorsum of the foot, anterior to the medial malleolus, on a line connecting spleen 5 and stomach 41, in a depression medial to the tendon of the anterior tibial muscle. Genital diseases, kidney diseases, lumbago, dysuria, seminal emission. Disease along the channel. Needle perpendicularly 0.5 to 8 cun. Liver 5, Li Gou, the Luo connecting point. On the tip of the medial malleolus of the leg, 5 cun above the tip of the medial malleolus, on a middle of the medial surface of the tibia. Gynecological diseases, cold lower legs, liver and kidney diseases. Also, incessant erection. So, if you want to quell the fire without rubbing one out, then this is the way to do it. Genital itching as well. Needle transversely 0.5 to 0.8 cun. Liver 6, Zhongdu, the Shi cleft point. On the medial side of the leg, 7 cun above the tip of the medial malleolus, on the middle of the medial surface of the tibia. Gynecological stuff, persistent flow of lochia. Disease along the channel, liver and kidney diseases. Needle transversely 0.5 to 8 cun. Liver 7, Xiguan. On the medial aspect of the lower leg, posterior and inferior to the medial epicondyle of the tibia, 1 cun posterior to spleen 9. Liver 7, 1 cun posterior to spleen 9, and it is the knee gate. Guess what it's good for? Knee pain. You win. $35. Needle perpendicularly 0.8 to 1 cun. Liver 8, Chuquan, the He point. On the medial aspect of the knee at the medial end of the popliteal crease when the knee is flexed. Important, you gotta flex it. Posterior to the medial epicondyle of the tibia in the depression in the anterior border of the semimembranous and semitendinous muscles. Gynecological stuff. Disease of the external genitalia. Liver diseases. Kneecap. If the plants need watering, then you use Jueyin. Liver 8. Needle perpendicularly 1 to 1.5 cun. Liver 9. Yin bao, yin wrapping on the medial side of the thigh 4 cun above the medial epicondyle of the femur, between the medial vastus muscle and the sartorius. Pain in the lumbosacral region, radiating to the lower abdomen, dysuria and uresis, and irregular menstruation. 0.8 to 1 cun. Liver 10. 足物里 on the medial side of the thigh, 3 cun, inferior to stomach 30, at the proximal head of the thigh, below the pubic tubercle, on the lateral border of the long adductor muscle of the thigh. This is for distension in the lower abdomen, particularly with retention of urine. Needle perpendicularly 0.5 to 0.8 cun. Liver 11. Yin lian. On the medial side of the thigh, 2 cun inferior to stomach 30, at the proximal end of the thigh below the pubic tubercle, and on the lateral border of the long adductor muscle of the thigh. For irregular menstruation, morbid leukorrhea, pain in the lower abdomen, pain in the thigh and leg. Perpendicular insertion 0.8 to 1 cun. Liver 12. Ji mai. On the lateral side of the pubic tubercle, lateral and inferior to stomach 30, in the inguinal groove where the pulse of the inguinal artery can be palpated, 2.5 cun lateral to the anterior midline. Pain in the lower abdomen, pain in the external genitalia, and hernia. Perpendicular insertion, 0.5 to 1 cun. Onto the abdomen. Liver 13, Zhangmen, the front mu point of the spleen and influential point of all of the Zang organs in the entire universe. Influential point of the Zang. On the lateral side of the abdomen, inferior to the free end of the 11th rib. All things spleen and stomach, all things liver and gallbladder. Very useful point because of this. Also lung diseases because of its location in the chest. And kidney diseases. Liver and kidney share a same source. Liver has a pushing function, kidney has a holding function, so these tend to go together. As well as mental diseases, fear, fright, irritability, infantile convulsions. Perpendicular, definitely not that. Oblique insertion, 0.5 to 0.8 cun. Liver 14, Qimen, front mu point of the liver. Also a good point to punch somebody if you want to shut them down, because this is the end of the circuit before it goes to lung channel. You break that connection, then, heart feels really cold and people kind of go down. On the chest, directly below the nipple, in the 6th intercostal space, 4 cun lateral to the anterior midline. It's on the chest, it's a liver point, so chest and hypochondriac diseases. It's on the chest, so cough, asthma, and shortness of breath are going to be there. Also, spleen, stomach, and interstitial diseases. Liver and kidney diseases, groin pain, enuresis, retention of urine. Needle obliquely, 0.5 to 8 cun.